of you have ever been sick at some point in time in your life? Raise your hand. Now keep your hands up if every single doctor you've seen in those moments truly saw you, listened to you, and made you feel like a human being and not a medical record number. Look around. Why did so many hands go down? The system that decides who becomes your doctor is designed to process thousands of applications from aspiring pre-medical students. It focuses on grade point averages, test scores, and research publications, those things that can be counted, compared, and ranked. And in pursuit of that efficiency, we have created something deeply flawed. Because the qualities that make a great doctor, empathy, resilience, lived experience, don't show up on a transcript or a multiple choice exam. Yet every time the system filters out someone with those qualities based on rigid academic algorithms, we make two mistakes at once. We lose a healer who could have truly connected with their patients, and we lose the patients who need them the most. Your mother, your child, even you. Who gets to heal? Now, I know this system intimately because I applied to medical school 3 times, 50 applications in total, and not one school offered me an interview. It wasn't until an unplanned detour through a master's program where I finally got my one yes. Just one school said yes, but I had done it and beaten the odds. I was on my way to becoming a doctor. And then came the exam that nearly ended everything. Pass, and you move on to your clinical years of training. Fail, and you don't get licensed to practice medicine. I failed. I had to take a month off, restudy, and took the exam again. And I failed again. I remember the day the scores came out. I left campus and drove home because I did not want to be around anyone when I looked at my results this time around. I sat down at my desk and I opened up my laptop. My heart was pounding against the backside of my rib cage and my palms were damp with sweat. And as I opened the email, I scrolled down and gazed at my score. 3 points. I had missed passing by 3 points. Sobbing uncontrollably, I screamed and I cried out to God, just take this, take me, take my life. Because I couldn't bear the pain or the shame or the embarrassment of having to go through that again. And in my darkest moment, he answered me. He said, I have a community that's already waiting for you. I'm sending you. And for the first time, I saw my struggles differently. Not as proof that I don't belong in medicine, but as preparation for the patients who would need me the most. You know, isn't it ironic that the very profession whose sole purpose is to save lives nearly took mine, but it didn't. I passed my board exams on the 3rd attempt, and now I care for patients on the south side of Chicago. And I carry every rejection and every moment of that devastation with me, not as baggage, but as my equipment. One Friday afternoon, I walked into the exam room to introduce myself. It was my last patient of the day. And as I entered in, she promptly shouted, "And who the hell are you?" And I thought to myself, oh dear, here we go. She was a veteran. Her kidneys were failing, and she needed to start dialysis, or else she was going to die, likely within a couple of weeks, but she was adamant. She was not starting dialysis, and this was not up for discussion. Now, I could have walked out, but I sat with her, and eventually her anger gave way to the fear in her eyes, and she told me the truth. Her son also had kidney disease. His kidneys were failing, and he was on dialysis. As a result, his health started to fail. And one day she came home and found him dead. So for her, starting dialysis wasn't about facing her illness. It was about reliving the darkest moment of her life. And I understood her brokenness and her hopelessness, because I'd been there, sitting at that desk, sobbing, facing the darkest moment of my life. And that's what I brought into that exam room. She never once asked me about my grade point averages or my test scores. She just needed someone who saw her. The credentials didn't matter. The connection did. Now, I'm not the only one who almost walked away from medicine. When I was in residency training, I met a nurse who was caring for one of my patients. And she asked amazing questions, deep clinical questions. Dr. Roberts, why are you prescribing this particular antibiotic? And what will this mean for the patient long term? One day I stopped her and I said, you know what, you sound like a doctor. And she got quiet. And then she told me her dream had always been medical school. But she bombed the MCAT, the Medical College Admissions Test. So she gave up and walked away. And then I told her my story, the 50 rejections, failing my board exams twice, and even the moment I wanted to die. And I asked her, are you gonna let a test score steal your dream? And I saw the spark in her eye. She reapplied and got accepted. And today, that nurse is saving lives as a critical care physician, standing between her patients and death. And I think back on that moment and what that meant. So what does all of this cost us? The American Association of Medical Colleges, the organization that governs medical schools and administers the MCAT, published a research study on what their own test predicts. And the research shows that MCAT scores predict how well students do on written exams during their first 2 years of medical school. That's it. It doesn't predict clinical skills with actual patients or predict how well students will communicate with patients as a doctor. Yet the MCAT remains the primary gatekeeper to medical school admissions. Meanwhile, the United States is projected to have a shortage of 86,000 physicians within the next decade. But what if the candidates we need are already here and the system can't see them? I call them the medical misfits. The ones the system has labeled as not competitive enough because we don't shine on a scorecard. We don't have a physician shortage. We have a visibility problem. Now, I'm not saying that we lower academic standards. I'm saying we should raise different ones. Because here's what the research tells us. Communication failures between doctors and their patients results in 2,000 preventable deaths each year in the United States. So selecting for empathy is not a feel-good initiative. It's a patient safety strategy. And the medical misfits, they're the answer to the crisis we're in. So here's what I'm proposing. Stop measuring only those things that are easy to count and start measuring what actually saves lives. Give patients a seat at the table. Let patients have a voice in determining who gets to heal. Because who better to identify a healer than someone that needs healing themselves? Now, remember when I asked you who had a doctor who truly saw them? Remember this. The next time you're sick, and I mean truly sick, sitting in that exam room or lying on that hospital bed scared, vulnerable, hoping someone will listen to you, who do you want walking through that door? The next great doctor may not ace every single exam, but they'll pass the one that matters most, yours. Thank you.